Do you know someone with ADD, ADHD, or SPD, sensory processing disorder, or some version thereof? Maybe it's a child that you care about, maybe it's somebody you live with, a friend or family member. Please share this video with them. I'm going to share with you some very important information that not a lot of people are getting from their doctors or healthcare providers. Now, I'm going to share this information via Andrew's story because Andrew was a patient of mine. My name is Dr. Craig Burns. I'm going to share a story about Andrew that happened many, many years ago. He was brought to me at the age of 9. He had headaches. His mom brought to me because she was concerned about his headaches, but also because of his ADHD symptoms and the fact that he was taking Ritalin every day just to try to cope and manage, and there seemed to be no end in sight. And she was concerned about his future well-being, as any parent would be, of course. Now, there's something that I've been doing with these types of conditions. Doesn't matter whether it's child or adult. I tend to find a very common problem that's often overlooked or misdiagnosed. And I believe it to be part of the root cause of the condition. Now, a lot of times with these symptoms or these issues or conditions, it seems like the body is just stuck in the wrong gear and not operating properly. And that's where doctors, at least Western medical doctors, feel the need to medicate. Oftentimes, as I describe it to patients, is the nervous system, the body should be functioning at an optimal plateau or level here. Smooth waters across the nervous system for optimal function within and throughout. And a lot of times people, for various reasons, and I'll explain one very important one in a moment, get stuck in high gear or they get stuck in low gear. In this case, oftentimes these people are stuck in high gear and their body is just overreacting, oversensitive, and has problems functioning normally. And oftentimes we try to medicate these people to bring them down to a normal level of function or bring them up to a normal level of function. But that doesn't necessarily address the root cause of the condition, now does it? So one common thread or theme I find amongst many of these individuals is an upper neck problem. Yes, my name is Dr. Craig Burns. I'm the owner of Maximized Health Chiropractic, and you wouldn't think that you would bring ADD or ADHD or SPD to a chiropractor, but maybe you should, and here's why. This region of the neck, the upper neck, is a very delicate area. It's where the brainstem is. It's a neurological hub of the human body. It's very close to the brain. Unfortunately, these two bones in the upper neck are very movable compared to the other bones. That allows for a large margin of error to happen here. Now, it's not really a bony problem or a muscle problem, although that can cause headaches like it did for Andrew. More importantly, it can cause neurological issues and cognitive processing issues. And that would be more of the root cause, if in fact it exists, getting a person stuck in high gear or low gear. And that's where medication doesn't really solve the problem because that's not the root cause. The medication doesn't solve the physical abnormality or the biomechanical problem. Oftentimes these things can be easily detected on a simple exam. You can feel a problem here. Oftentimes I can help the patient or the parent even feel it and notice it themselves if it does exist there. And then if it does, we'll often verify it with an x-ray. So these are Andrew's x-rays, his initial one when I first found him and met him, and his old one right before he left our office. Now, here you can see he's looking this direction. That's what you're looking at, a side view of the neck. There should be a normal arc in the neck. That's the normal shape for the human spine to exist in that region, which allows for the muscles and joints to be happy and healthy. But more importantly, it allows for the nervous system to be happy and healthy and stress-free, especially in a delicate area close to the brain. In his case, he was very flat and misshapen. He had a structural shift, and he was very tight and tense, and he had a lot of knots and spots on a certain side of his neck. So that would indicate that he probably had a slip or a fall. Maybe it was a trampoline incident for some people. Maybe it was the birth process and the stress on the neck. Maybe it was a rough housing as a child. The causes and events can be numerous. Point being is, that's not normal. That's not normal. And that's something that we can easily find and we can obviously correct and fix. When we take the tension and pressure off of the system, the muscles and the joints, yes, oftentimes the headaches will go away, and that is wonderful. But more importantly, when the neurological tension, the nerve stress from physical tension from the spine goes away, so does the condition oftentimes. So does the need for medication, such as the case as Andrew, and I've seen countless individuals go through the exact same process as him. Girl, guy, young, small, old, young, doesn't matter. Not all of them, but many of them have this. It's not being detected and it's not being treated properly. Therefore, the only viable option at that point is medication indefinitely. I would say if you have this condition, ADD, ADHD, or some version of SPD, at least call our office or an office like ours for a very simple checkup, because this is very easy to look for. It's very obvious because you can't argue with the picture, and it's obviously very easy to treat. No more headaches, no more ADHD, no more Ritalin. Many years later, college student thriving in life, that's where everybody deserves to be. So if you know somebody who has this issue, please share this video with them. They've probably never been taught that this is a viable cause or issue that could cause AD, ADHD, or SPD, and they should at least get a checkup to see if it is in fact the root cause of the condition, because it is a treatable and improvable condition, as you can see. How can we help you? This is our office phone number, 303-462-4476. We have an outstanding reputation as the #1 reviewed chiropractic clinic in Colorado for various reasons. One of them being we care about people, and we don't want to treat people's symptoms. We want to treat the root cause of the condition, and we do it right, and we do it better than anybody else. Please give us a call, mention that you watched this video, and if you don't live locally, please share this video with as many people, family, friends, parents as you possibly can. More people need to know that there is a better solution than medication. Thanks for watching. Bye-bye.